Pain balms, cough syrups, antacids. Are these everyday medicines secretly dangerous after 60? Let's find out. OTC medicines means over-the-counter medicines. These are medicines that can be purchased without a doctor's prescription. Examples include pain balms, cough syrups, antacids, cold medicines, and many others. They are easily available in pharmacies and often used for quick relief from common problems. But an important question is, are they always safe for seniors? As we grow older, our body processes medicines differently. The liver metabolizes drugs more slowly, and the kidneys remove medicines less efficiently. Many seniors are also living with conditions such as high blood pressure, diabetes, heart disease, kidney problems. Because of this, even common OTC medicines can sometimes cause side effects or dangerous interactions. Many people believe that if a medicine is available without prescription, it must be completely safe. But OTC medicines still contain active chemical ingredients. When taken incorrectly, they may cause side effects, drug interactions, worsening of existing medical conditions. One of the most important habits is reading the medicine label carefully. Always follow the recommended dose and duration. Never exceed the maximum daily dose. Also check the active ingredients, not just the brand name. Different products may contain the same ingredient, which can lead to accidental overdose. Every senior should keep a written list of all medicines they are taking. This includes prescription medicines, over-the-counter medicines, vitamins and supplements, herbal products. This list should be reviewed regularly with a doctor or pharmacist. With aging, several factors increase medication risk. Reduced kidney and liver function can lead to slower drug clearance. Many seniors also take multiple medicines, a condition known as polypharmacy. In addition, cognitive problems like memory loss can increase the risk of double dosing or incorrect use. Pain balms are extremely common in Indian homes. They usually contain ingredients such as menthol, camphor, capsaicin, methyl salicylate, or antacid-based gels like diclofenac. These products help reduce pain by creating cooling or warming sensations. However, excessive or repeated application can sometimes cause skin irritation or burns. Pain balms should not be applied on broken skin or wounds. Avoid covering the area with tight bandages or heating pads. Large area application may lead to systemic absorption, especially with salicylate-containing products. Even topical NSAIDs can increase stomach and kidney risks if used together with oral pain medicines. Many cough syrups contain several ingredients. These may include dextromethorphan, cough suppressant, guaifenesin, expectorant, antihistamines, decongestants such as pseudoephedrine. In seniors, some of these medicines can cause drowsiness, confusion, dizziness, constipation, urinary retention. These side effects may increase the risk of falls. Decongestants can increase blood pressure and heart rate. This can be dangerous for people with hypertension, heart disease, or arrhythmias. Also watch for hidden acetaminophen in combination cold medicines, which can cause liver toxicity if taken with other pain relievers. Antacids are commonly used for heartburn and acidity. They may contain aluminum hydroxide, magnesium hydroxide, calcium carbonate, sodium bicarbonate, while useful for short-term relief. Frequent use may cause constipation, diarrhea, or electrolyte imbalance. Long-term use of acid-reducing medicines, such as proton pump inhibitors, may increase risk of bone fractures, certain infections, nutrient deficiencies. Persistent heartburn should always be evaluated by a doctor. Another important concern is drug interactions. For example, antacids may interfere with absorption of antibiotics or thyroid medicines. Cold medicines combined with pain relievers may cause liver toxicity. Sometimes these interactions are silent, with no early warning signs. Some seniors may forget whether they have already taken a dose. Using pill organizers or medication charts can help prevent mistakes. Family members should also assist when necessary. Seek medical help immediately if you notice severe abdominal pain, black or bloody stools, persistent vomiting, dizziness or confusion, shortness of breath, or chest discomfort. These symptoms may indicate serious complications. Always keep your medicines in their original packaging. Check the expiry dates regularly. Store medicines in a cool, dry place. And always buy medicines from trusted and reliable pharmacies. In many Indian homes, pain balms and cough syrups are used frequently. However, some combination products contain multiple active ingredients. Before starting a new over-the-counter medicine, it is always safer to consult your pharmacist or doctor. Over-the-counter medicines may seem simple, but for seniors, they can sometimes cause unexpected problems. Always read the label, understand the ingredients, and never hesitate to ask your doctor or pharmacist. A little caution today can prevent big health problems tomorrow. Safe medicines mean safer, healthier senior years. Health in the senior years needs care, awareness, and family support. If this video helped you or your loved ones, please share it with someone who may benefit. Stay informed, stay safe, and keep life simple and healthy. This is Sahaj Jeevan, supporting seniors and families for a better tomorrow.